Blood type and disease, how are they related? Since the spread of the new coronavirus, COVID-19, to the United States in 2020, we have been repeatedly warned by scientists and doctors that people who are susceptible to being infected by the coronavirus are in more danger than the young and strong. People with underlying diseases are more susceptible, men are more susceptible than women, Black and Latino people are more susceptible than whites or Asians. What's more is that the difference in blood type is also a factor for the new coronavirus. People with blood type A have a 45% chance of being infected, while people with blood type O only have a 35% chance of being infected. The difficulty of getting the disease for the other blood types lies between the A and O data. What is the significance of these statistics? What is the relationship between blood type and disease? This includes the scientific knowledge behind race genes and blood types. Scientists have devoted themselves to research in this field, digging for decades, and have obtained some theoretical foundations and clinical knowledge. Let's take a look at the various data and analyses. We all know that human blood types are mainly divided into 4 types: blood types A, B, AB, and O. Though there are other blood types, they are rarer, so we will skip over them for now. From the statistics of the American Red Cross's blood type and ethnicity, people with AB blood type account for the smallest proportion of all ethnic groups, about 4%, and people with O blood type are almost more numerous, accounting for about 40% to 57%, followed by people with type A blood, accounting for 26% to 40%, and people with type B blood accounting for 10% to 25%. The principle of blood type classification, according to the classification method of the blood contained in the blood, antigen and Rh factor. Antigen is a type of protein on red blood cells. According to the type of antigen, blood is classified as type A, type B, type AB or type O. When antigens come into contact with substances that are unfamiliar to the body, such as certain bacteria, they trigger a response in the human immune system. This is why if the blood type of the donor does not match your blood type, the same reaction will occur during the blood transfusion. In this case, your blood cells will clump together and may cause fatal complications. Rh factor is also a substance on red blood cells. This is the positive and negative signs next to the blood type. If you have the Rh coefficient, you are considered Rh positive. If you don't, you are considered Rh negative. Whether you have the Rh coefficient is usually only closed until pregnancy. The Rh identities of the mother and baby need to match. If an Rh negative mother gives birth to an Rh positive fetus, once the Rh factor on the fetal red blood cells enters the maternal blood for some reasons, such as bleeding caused by placental exfoliation, the mother will produce anticoagulation element, anti-Rh antibody. Anti-agglutinin enters the fetal circulation through the placenta, causing the fetus's red blood cells to agglutinate and die, which can lead to severe fetal anemia and even death. Modern medicine already has a way to keep pregnant adults and children healthy. Different blood types have different results in the face of diseases. Number 1, heart disease. A new study was published in the journal American Heart Association Arteriosclerosis, Thrombosis and Vascular Biology. Researchers found that compared with type O blood, patients with type A or type B blood had an 8% higher risk of heart disease and a 10% increase in heart failure risk. Type O has the lowest risk and type B has the highest risk. What is the reason? Because there is a gene called ABO gene. A gene exists in people with blood type A, B, or AB. The only blood type without this gene is type O. The ABO gene can increase your risk of coronary artery disease. When the heart's output vessels harden and become narrow, CAD develops, and if the heart is blocked, it can cause a heart attack. But the biggest difference is blood clots. Compared with type O blood patients, individuals with type A and B are 51% more likely to develop deep vein thrombosis, and 47% more likely to develop pulmonary embolism. Number 2. Brain function and memory loss. Only 4% of the US population has blood type AB, and the ABO gene is related to brain function and memory loss. Compared with type O, people with blood type A, B and AB are more likely to develop cognitive and memory problems up to 82%, which can cause dementia. One possible reason for this memory loss is that blood types can cause diseases such as high blood pressure, high cholesterol, and diabetes. These conditions can lead to cognitive impairment and dementia. Blood type is also related to stroke, which happens when blood stops flowing to the brain. People with AB blood type are more likely to lose memory. According to a 3.5-year follow-up study published by Harvard University in 2014, AB type is the most likely to suffer from mild cognitive impairment among all blood types at high risk of dementia. Compared with the other three blood types, type AB people have an 82% higher chance of suffering from dementia. Among the other three blood types, type O is the least likely to suffer from dementia. Number 3, risk of cancer. A. Gastric cancer. Research on the relationship between blood type and cancer has been conducted for more than 60 years. Compared with people with other blood types, people with type A blood have a higher risk of stomach cancer. This may be because Helicobacter pylori infection is more common in type A blood patients. That is a type of bacteria usually found in the stomach. It can cause inflammation and ulcers. The ABO gene may also play a role in increasing the risk of cancer. This gene is related to other cancers, including lung cancer, breast cancer, colorectal cancer, prostate cancer, liver cancer and cervical cancer. B. Pancreatic cancer. If you are type A or type B, your risk is even higher. The molecules in type A and type B red blood cells help certain bacteria, called spiral bacteria, grow in your intestines. It will make you more susceptible to pancreatic cancer. According to data released by the National Cancer Research Center in 2009, it took 10 years to track the health of 80,000 American citizens. It can be found that even if other pathogenic factors including lifestyle habits, smoking or not, eating habits, age after exclusion, the risk of pancreatic cancer for type A is still 1.3 times that of type O, 1.7 times for type B, and 1.5 times for type AB, and type B has the highest risk of pancreatic cancer. Another study, the Nurses' Health Study, also showed that the risk of pancreatic cancer is the lowest among individuals with type O blood. Compared with individuals with type O blood, the risk of pancreatic cancer for type A blood is 32% higher, and that for type AB blood the risk of pancreatic cancer is 51% higher, while the risk of type B patients is 72% higher. The researchers pointed out at the time that both pancreatic cancer and gastric cancer are highly associated with Helicobacter pylori infection, and the immune system of type O patients is more able to block the invasion of Helicobacter pylori, so the risk of suffering from gastric cancer and pancreatic cancer is also relatively low. According to a 2015 study by the U.S. Center for Health and Health Research, not only the overall mortality rate of O-type people is 9% lower than that of other blood types, but the gastric cancer mortality rate is 55% lower than that of other blood types. Number 4, stroke. If you have type AB blood, your risk of stroke will increase. Doctors believe this is because its blood clots more easily than other types. Taking the proportion of lymphocytes contained in white blood cells as the standard, compared with type O, which has 39% lymphocytes, 37% of type B, 36% of type A, and only 34% of type AB. Therefore, compared with other blood types, the immune cells of the O type can detect and eliminate pathogens faster, while the AB type is the most vulnerable to stroke among the 4 blood types. Number 5. Diabetes. According to a study conducted by the French National Health and Medical Research Center in 2014, an 18-year follow-up survey pointed out that compared with type O people who are less likely to develop diabetes, type A people have a 10% higher risk of developing diabetes and type B it is 21% higher, and the AB type is also 17% higher. Type O is the least likely to suffer from diabetes, and type B is the most easily available. Number 6. Thrombus venous thromboembolism. Thrombus venous thromboembolism refers to blood clotting in deep veins, just like thromboembolism in the legs. These blood clots can sometimes move to your lungs. Studies have shown that people with type A, B, or AB blood have a higher risk of VTE. In general, if you have blood type O, you have a higher chance of lifespan and you will live longer. Experts believe that your reduced risk of heart and cardiovascular disease may be one of the reasons. Although the influence of genes on the proportion of disease exists, people should pay more attention to quitting smoking, taking more aerobic exercises, dieting and losing weight in daily life to truly ensure that they have smooth blood vessels, increase physical fitness, and enhance immunity. Sick, don't get sick, be healthy, peaceful, live happily, and enjoy all the beauty and pleasure of life. Thank you for watching. Did you like today's video? If so, like and subscribe to see more and stay tuned. Goodbye.